My eating disorder was a way of trying to cope with my life, a way of trying to gain control over the painful events in my life that I could not control. The eating disordered thoughts I had made me focus all of my energy on my weight, calories, and the food groups I ate, instead of the painful events in my life that I was powerless to do anything about. It crept in slowly and stayed with me for years. It made me believe that I couldn't cope without it, that being thin was the answer to everything. In reality, it wasn't. It made everything worse. My life resorted to an all-consuming obsession with numbers, and I thought of nothing but food. My self-worth was based on a number on a scale that I was never happy with, despite always being underweight. My sole purpose in life was to lower that number on the scale, and nothing else mattered. Therefore, my eating disorder began as an unhealthy coping mechanism that slowly devoured and devastated my life. I managed to keep my eating disorder hidden for years. Having primarily suffered with bulimia, it was pretty easy to keep secret. My parents noticed that I had changed, that my behaviour was erratic and unstable. They put it down to me becoming a teenager. In the beginning, I'd tell them that I decided to stop eating meat or junk food when they tried to offer me food. They thought it was a fad, that I'd grow out of it. Later on in my disorder, they'd find empty and full packets of food hidden in my room. They asked me about it, but I couldn't tell them why. I didn't even know why. I would avoid eating with them at dinner. I'd take food up to my room and tell them I was doing homework, which was easy for them to believe. I always worked really hard at school. When I had to eat with them, I'd either eat very slow or fast, depending on which part of my eating disorder I was in at the time. When restricting, I'd eat very slow. I played with my food, and I would drink lots of water whilst eating. I suffered with anorexia. When I left home at 17 with no parents to answer to, I could do what I wanted. I hid my disorder under baggy clothes, which I also wore because I was cold all of the time. When I was 19, I quit university and chose employment that would aid my eating disorder. I chose to work in pubs where I worked long shifts and was always active. I was also able to be around food without eating it. Despite restricting my food intake, I always liked being around food. I guess it was about control. Quitting university didn't seem like a big deal at the time. I always struggled with ambitions or what I wanted to do with my life. Nothing was as important as my eating disorder. Friends would be concerned about my weight, but I always managed to explain it away, saying I had a fast metabolism or other such excuses. I wish I'd let them in more now, because I truly believe they could have helped me. At the time, though, I was convinced that I couldn't live without it, and that other people wouldn't understand. Again, most of the time, I really didn't think it was that big of a deal, and that's why I suffered for so long in silence. Recovery from an eating disorder is possible. I never ever believed it was. My eating disordered thoughts told me that it was impossible, and that I wouldn't cope without it. I didn't want to give up being thin, but at the same time, I knew that I couldn't carry on the way I was. I reached a point where I finally realised that my life wasn't mine anymore. I wasn't in control of my eating disorder. It was in control of me. I knew that if I didn't get help soon, that I would no longer have a life to fix. I went to the GP and made an appointment with a doctor I trusted, and for the first time in my life, I was completely honest with him and myself. I told him that I didn't eat, that I couldn't eat, and that I thought I had a problem. I think he was a little taken aback by my honesty, but without being honest with him and myself that day, I wouldn't have got the help I received, not just from him, but from the whole team of people that I was referred to. Because I learnt to be honest with them, they were able to help me help myself recover from my eating disorder. I would advise anyone who thinks they have an eating disorder to visit their GP and to be honest. Everyone deserves recovery, everyone, and there's no need to feel ashamed. Recovery has helped me take my life back, and it can help you take your life back too.
first question is, why has this eating disorder developed? Unfortunately, there's no easy answer, as eating disorders can develop for many reasons.
There are some things that make people more vulnerable to developing an eating disorder, such as their general makeup, what's passed on to them by their parents, such as perfectionism, high anxiety. Physical problems in early development that require a special diet can also increase vulnerability to eating difficulties later on in life. If the individual is brought up in an environment where there is a large emphasis on body shape and weight concerns, this may increase their vulnerability to becoming preoccupied with these factors. There are also factors that can trigger off an eating disorder. These may include factors that affect self-esteem, such as abuse, bullying, or bereavement, dieting or a pressure to lose weight, and stressful life events, such as exams or going to university. Once an eating disorder is developed, there are many things that maintain it. These can include rules around the eating disorder, such as only being able to eat a certain number of calories a day, having to do so much exercise in a day, and frequent body checking and weighing. Many mislabel bad feelings as fatness, so need to relearn how to manage their emotions more effectively. Also, if the background issues around the development of their eating disorder are not addressed, change is unlikely to happen. Eating disorders develop because something has happened to affect their self-esteem or mood. Some people use their diet, weight, and shape to feel more in control, feel better about themselves, and gain a sense of achievement. Therefore, these things become very important to the individual, and they put more emphasis on controlling them. In order to control diet, shape, and weight, they begin to decrease their food intake and increase their exercise. These behaviours increase their vulnerability to binge eating, which in turn worsens their mood and increases distress. They can then become more determined to control their weight, turning to more compensatory behaviours, such as vomiting and laxative abuse. These behaviours result in an increased focus on their diet, weight, and shape, increased worry about it, and therefore an increased feeling of being out of control. This negative cycle of thoughts and behaviours makes change for individuals suffering from an eating disorder very difficult. You may have heard the term ambivalent, so when the individual understands the negative consequences of their eating disorder and why change is needed, however is terrified of giving up their identity, the thing that has provided them with a sense of control and self-worth. It is often described as being pulled in two different directions, as they can become very protective of their eating disorder, fearing that their one coping strategy is going to be taken away. Therefore, it is essential to consider, is this individual ready for change? A useful tool to use when asking this question is Prochaska's and Di Clemente's Stages of Change model. This model highlights the stages that an individual goes through when changing behaviour. These stages include pre-contemplation. When the individual is not considering change, they want to stay where they are. Contemplation. They are ambivalent, unsure about change. Preparation. They are ready to make changes and start thinking about what this could look like. Action. They are making the changes. Maintenance. Changes have been made and this holding these changes in place. And relapse. Taking a step back with some of the changes, falling back into old behaviours.
This model is a cycle of change, therefore highlighting that change does not necessarily happen in an orderly fashion. People can move back and forward between the different stages of change, or even be at different stages for different behaviours. What the cycle does highlight is that change is possible, however it does not happen overnight.
The type of help and treatment can vary from region to region in Wales, but all health professionals work from guidance called NICE guidelines, which recommend best practice and treatment. A downloadable leaflet tells you what treatment you can expect from your GP and other NHS services. A person with an eating disorder will deny that there is a problem, and it is often up to family members or someone in contact with the person to notice symptoms and gently challenge them. However, be warned, any changes related to food, weight, eating habits or exercise will be met with denial and anger, and the experience can feel unbearable. Try to create openings for the person to talk freely. For example, you could say, "I can't help noticing that things are quite difficult for you at the moment. Would you like to talk, or is there anything that I can do?" Ask if everything is okay at school, work, and maybe suggest that the person seems quite anxious or distracted. Try to build trust and do not make judgments about the person. Remember, challenges and concerns will be met with "nothing is wrong, I'm fine, and don't worry." The advice is do not give up and continue to challenge, voice your concerns and keep observing. Let the person know that they have a problem. Breaking the secrecy of the illness removes some of its power. Make a list of signs that you have observed that make you think that this person has an eating disorder. Talk to them about your worries, confusion, uncertainties, and give them the opportunity to express their point of view, and ask them to go to their GP or take them yourself if you're a parent or family member. Teachers or lecturers and work colleagues have a role to play too, and should take initial suspicions seriously. Raise awareness in meetings and ask others to watch for characteristic behaviours. These include isolation, absence from lunch, perfectionism within work, keenness for sport, and calorie-consuming sports. To seek help, there are a range of websites available. All have useful advice for sufferers, carers, and peers, including readable and well-researched information about eating disorders.